Yasaba, Yakokusia, Adia Afa, Eon. Say, a drew Apomodin, say, dear Pomodin, Sam, and Baba so Ghana for. Inti a fellow Ducasa for Yatuan, Mamma, Quaba, Medin, Eddie Abrantia, with CJ, Bomadi in the social media, and also Facebook, but a EBN Ghana, and I say, a Bimawa, maybe sure so like a page, you know. Like if you have a video now what comment it na say what like it we pian share no so na be ya foforo betimenya bi na o ma hwe bomodin na share say na be betimedru north south east and west and I say wiasema no mbe bia obi a betimensa akabi na wetima hwe dwumedie na de baba be somo ewo kasafoni so mo so mo hwe no TV no fa phone na frɛ wo nua bi no no so frɛ ni nua bi no nka nkyerɛ ne sɛ ɛda no ana sɛ ɛbrɛ ne duruo nti no onhwɛ EBN Ghana ana sɛ EBN TV na yɛ wɔ ne mapa ɛde ma ɛna yɛsua deɛ de bia mɛka mese sɛ edru dwumedi a yato ne din beyi wa no ɛwɔ eclipse in the morning so a yɛsua ne ma bebree ɛnyɛ sɛ yɛfo obi sa akɛkɛ de na ba bɛtena se yɛ ne na atwetwe nkɔmɔ na mmom yɛhwɛ the education part of it no ɛna yɛde som yɛahwɛfo ne yɛtiefo nti yɛ krado na etena TV na si chuku mu so a mo hwe no Facebook no stay good because ene besua de pa yade bi eyiniti na spread pa WHO yato mu din World Health Organization e de aba bonten a onu so bohu dewro se amanfo enhwe yi pa okọ mi ayete se South America, Thailand, Vietnam, no more makeka onyina. Ase ho no nyina ma nipa ni bi krampo ewu. Tie panye. Nipa ni bi krampo ewu e wasa ya de ewe ho. Aspreadie dudru mia ma aba Africa. Ema Center for Disease Control krampo aka ho asem. Africa Center for Disease mu nyina sase obi e ka ho asem. Me ne wo ka sei. Yade no edru Ghana. Tie panye. Edru Ghana na Ghana no so edru no so far no nipa ye nya anase yate se omanya bi eyo almost 38 plus edeko na biaye nso a ya bodin anase ye de attack se omanya sayare ni bi eye some part of eastern region ni biaye miaye bi na we na ya hwedin na producers adwen won se yade se na abai e wo se ye boa Ghana Health Service na ye boy yade no hu dawru e de kire Ghana fo na Ghana fo enhu se yade bi aba wan hwe yi a enyawa de be ye wo we de ansa ekun no se owura be ho ankasa na yenya openi kase ene no be twetwe nkomo oye doctor ni na wa ben wa adwumem for almost 11 years plus na nyema waye ebini oye multidisciplinary health practitioner oye general nurse oye pediatric nurse oye health educator oye medical sonographer and assisted productive technician we nyina nipa baako ene ye ntutimi hu se wa benyankasa ane yatima hwehwemu akwakoyi no se ye ne no ebetwetwe nkomo ene nidin Edi Mr Benjamine Yamuha na dodo na frɛ no Bencare na fedi no ye frɛ no Bencare kyerɛ sɛ odwi nipa ho ne din ana ke odwi nipa ho pa ɔno nene yenya na ye ne no betwetwe nkomo ɛwɔ ɛyɛ kasafoni so to de tinachire na sua de ba besomo no na yare ne din a obroni ato no Edi Dengue say edi eya na enwanwa so na ya mrofo ne timiti na chire eridi yalia no ama ne din COVID-19 ba ye the same thing yade bia Ebola the same thing timiti na se eridi ehun se din we ene ye fan to yade ene eno ena ye ka wan asem dengue fever ena ene ye bobu hu openika se mema akwa aba
minia brantie ye de nyame ase na meda one odwumayefo ase ene wahwefo no atiefo nyina sane okai no me de Bencare edina nkasa de Benjamine Yamuha yeah nti ene se me besra mo a na de nti a me bra ha a se me ba besra mo anopa ni se yeto ha na yese corona na office bi aba na your friend dengue fever be friend dengue is dengue or dengue depending on
whether right word in ankasa here
dengue fever what did I say it be kind of dengue depending on as either the American or the British asset but it's either you say dengue or dengue.
Okay,
do you understand see but whatever it is a condition nti anopa me baaya me se ye ba beboa ya hwefo ene etifo ene yenuanom amwo around our money any medical knowledge about some of these things na ya boa ne ate niam bi ase afa condition na aba eno ho nti me ba ha na chese anopa di nti a maba besra woni wahwefo eno no
nti ye beda wase se oje pene na oba enim so schedules ye bebre omo a wo hwe omo fie ene omo a wo hwe omo clinic ni hospital ne de keka hu nyina ye dase se waje pene na waba yembo ransam ni mu ye ye ka se dengue fever ye de ade potin because ye nyina yate fever malaria typhoid ni nyina wo the same level na we de yeda sorry ya yesi bibi di dengue fever eno ne dia
okay but that's it nti you can dengue fever and I said dengue fever na a virus na virus no obi a ochiche obi a ya wo fa se ba ko e friend mosquito aye ne na tena ono adafo ya na asa akofa dengue fever yi aba
tuntumi ya ye no omu wo yi
en tuntumi ya ye ne omu etelight bill tue ade bia yenhu how much omutua so de bia ne omu na tifie
I see
so omu na akofa eno aba omu bre ya malaria na omu hu se malaria asesi no yehu ani so
kakra mo combat malaria
nti say omu so asa akọ strategize e de foforo aba asesi wa ba be duru Ghana produce mu ha say a friend dengue fever na ya ka dengue fever sanam din kankan na virus na virus no mosquitoes no na distribute ya a particular mosquito friend Aedes mosquito
so this one anopheles no Aedes
yes but to make issues simple for all of us
okay
mosquito in the deba mosquito be any how about name tag into unko who say mosquito with the anopheles with the Aedes mosquito is mosquito the most important thing is avoid being bitten by a mosquito any kind of mosquito but your mosquito we only Ghana can no aka say we fi Ghana we fi Cote d'Ivoire mosquito is mosquito just avoid being bitten by a mosquito because you cannot tell mosquito okra dengue fever and a mosquito onkra dengue fever but what I say so what we are trying to tell is you should avoid this mosquito as we speak 36 cases and I confirmed as at 17th July from Ghana Health Service 36 confirmed cases in from the central region and then the eastern regions it is a dengue fever we know say mosquito ne kawa that is mosquito okra dengue fever no and let me say this opikifi nipa ho so what it means is that the mosquito itself no or manufacture virus mosquito nankasa nye abo a okreti dengue fever ono ne de ne say oye distributor nti omo aya say riders omo ye delivery no nti omo ye dengue fever delivery agent
okay
nti ono ko fafi baby a no akọ deliver nti nyame anya wadom na say box a yede ma no no wo din na bo ho a na che say ode abrew ya meme de enso a na ode abre me
no okofa free hifa
yes nti it's a human mosquito human cycle
I see
human mosquito human nti ɔfa fi nipa ho na ɔsa de akɔma nipa. So what happened was ne ni Ghana ha. There were other places like the Benin, the Togo, and then other countries. So what happened is either say obi na sa virus no one ho eba country nim mosquito no, then the mosquito ended up distributing the virus.
Okay.
Good. And now say mosquitoes na bi so say na ne omutifia omuntua rent no. Saa na ombetimi afo flight afo ship omuntua any flight fare. Pacho atimase ha nti possibly if your flight be fit that country eba country there was this kind of mosquitoes in the flight, or a cargo came, or even a car somebody drove. Now we are able to drive across countries. Somebody drove and then ended up giving free lift to a dengue fever mosquito. Or de aba Ghana has seen. It is in the abaha. So the best is for us to try as much as possible. Say mosquito bites, no, you better prevent it, and I say you better reduce the bite of mosquitoes.
Yeah. Inti we dey watch re aboa ko a okofa mosquito no e dey ba ye say na wama ya tia say from human to mosquito, then from mosquito to human cycle na dey ma ye no wama ye atia say na ye nhwa de say ebi enyawa anase say aboyi ebaba beka wa dia na ya esi ewo wuridie mu ye pe early symptoms and anase signs, because me no ka say ebi ana obi krampo enya sa early signs ba oni akwakoto para
yes
we yi na ni efire so emfa no ho kra dia ni early signs.
Good. Into dengue fever no in the clinical setting, no, your friend of a part of what we call the febrile conditions. Febrile, just a feverish. Okay. And usually, say abuana kawa enye immediately na obe shows symptoms. No. In fact, some people do not even show the signs for us to see, but they are having it. And some of the obvious obehu and I say nipa ne be complaining of is high body temperature, what we call fever. Okay, and usually a temperature which reads like from 38 degrees upwards. Okay, that's high grade fever. And obi one more be catch us miti ayamia. And one common thing is a ban of dengue fever headaches now. They're usually around the forehead. All right, just the headache more concentrated
until when the full head, no.
Yes,
and then your migraine, so you have when the concentration is on the forehead.
Yes.
Okay.
And most of the headaches and severity, around the forehead, and in some cases you see some rashes on the skin. In most cases, when someone complaining of general body weakness and pain, to say the malaria at time. Good. To be say nipa no complain say omtia me ya award me honam nyina ya me ya, and they can have joint pains, all right, and then muscle pains. Okay, and see obi wa see me dompe mu ya me ya me body nyina ya me ya me joints ya me ya. Now vomiting can also be part of the symptoms. So vomiting, headaches that is more concentrated at the forehead, high grade fever, rashes on the skin, joint pains, muscle pain, bone pain. These are very common complaints nipana ebesho.
Busia ye there two screen so e dey ama we ni symptoms wonya dengue fever na eyew na sana doctor e kira se no eni malaria na nkasa symptoms so ya yepe o hwe the doctor e kire ya I say iti we crampo no se enyawa obefi say malaria so na dengue.
Yeah.
Because similarities will hop similarities in the war ohwe eni asaweni how bisa mehu obi a ofe sana doctor kan no abdominal pain so obi aso ase ne fu honum baby nti okay nti ebusia wo de kinkan bi na he sa wo nya symptoms yi a na wa advice ho ba ye beba o doctor be cheche doctor na point bi
o hwe rash the kind of rashes na o hwe ni picture na da ho na wo se nipa na nsa ho ha ba nya won nsa ho nko a
the whole body no me pacho mompe rashes no sana aye obi no nti ye nya bi Ghana hanom ne bi bae no yenya nkrofo ni bia e bia to apeto mo ho prekese mompe no enfanto so fama me yesra o viewers discretion untimi hwa wadaroma na wode waso kwa amaye nti weye obi a wenya yare yi bi na imagine so wonya bibi se a obesi den krampo no akoni pem wa ware krampo ukun pese obeben
we there
ana doc meboa
this is called commercial break work and then
I just say isolate too
so what is more important is that won't be nyano say contact what I say be a medem ho account
and you contagious
what I say but say e be am omoja abefra me moja na say entontom bi aka nipa na wenya dengue fever e wo fie ho no nti yemfa se high fie na se me wo dengue fever na se mosquito come na be kawa you get it I say
na say ne ba ko fo futu you be a
nti se bibisa mo suspect bibisa akra wo fie a e be best se nipa no obi mo ba na use mosquito net so I say aha na mo this mosquito repellents mama na use na mo nso so mo na wo fie no e be ya nke ya mo make sure say you wear long sleeves and then trousers you don't expose your body so e be a mosquito enyawa onfanchew so you try as much as possible say all the time no you prevent say mosquito be kwa kanipa kro wanya but yem pese mosquito din be ye
dog we dey severe pa ase esama ohonam keka wo onya ichi body nto hwe we na nipa ku na titia na moja efiri mu ba
nti rashes na papai rashes na papai nti moja na ifi
and eba in a form of blister na nti timi pai
ebe pai ha ebe pai ana say because of say nipa no eda ho or down no no that force no so bit mama blisters no then papai nti papai sana now the blood is exposed even mosquito
ebemu dey serious pa ebusu amofa nche yen na ye di bibi kakra fra unhu de ye kire no oh enti na yakofa doctor kukudama obetima cheche sanyema we nyina e di bibi to so a unhu de ye pa kire na ankasa ba we ye de bo kokko on say ye create awareness e de boa ye Ghana Health Service because me know ka say Ghana ye nya 36 nipa mako omenya yare ni bi omenya 36 enti say ya mohu de wura ye nim nipa ko obetime nya bi a ebetime krampasa abaye nchen
that's true
enti me pa cho mofa nche yen se wo hwe na se eni enya ya fa che yen pa na ye nsua de fa mfiri ade we doc na wo ka bibi
yes ade ba ko nso amepese meka atoso no say yare we as we speak eni adru yes eni cure you understand inti say unya na say even here the call hospital cra what we do is symptomatic treatment you treat symptoms inti bia miti pai me mahaya me ya so we'll give you medications that are able to take care of some complaints now all kind of but send the cure the nibi the vaccine or but in Ghana yenya vaccine nti system so yentimi vaccinate obi against dengue fever nti the most important thing me no e bit my na say ye bebo ye ho ban I believe say ye be call ahobambo no
so there
but ye fan say so obi anya bi sisi ye need treatment be cure dengue fever.
Na doctor skin nso ese na aye prekese was skin nso no obesi den na akọ.
See, and I make us a symptomatic treatment. So something like this, on bet my medications are you treat skin allergic reactions.
Okay.
So I say,
Okay.
no honoma, ya bema on na say a dani crua, you know honoma be treat a chrono. Now be one so off it. So we treat a dear bema a fiano because off it too much we lose fluid. Na bema nipa crawl na so bete we look
ha.
What I say
a pale crass
why pale aka ho obi wo kra otimi fia na afi yehu moja ewo afie nim so what I say ha bi ne eka say ubet pain ewo wani ebi wo na wani ati say no inside the ani na ati side ho no na wote sa pain no obi wo no man yefunu ya ne ya ne. So it mimics the symptoms of malaria.
Malaria na.
It mimics the symptoms of malaria. There's some classical parameters bia you do say no way any malaria until let's go further to check. Yeah.
Doc, sana na work say make malaria no. Ebia no obi enye bi. Ono fin say malaria nti okwa Pedro bi anom. Doc, sa nipa akono ebia otie sesi a ede na oka che sa nipa akono.
Good. Nti the make catch obia na say sane Ghana yenim no your pocket doctors bebre uko fie bia mu a obi wo honom a why self acclaimed doctor e wo honom a say obi hu mfa na ono atimi bonitri man diagnosis o abonitri man treatment
self prescription
afi amfa na afi ope other alternative. So what we say because of dengue fever ya abai na yenim ho issues papanti and I knew solutions to it comprehensively no who symptoms bia ya bobo so na though it may be malaria but if you are not sure don't start treatment because enro bi wo honom a obefa ama you run into complications.
Okay.
It is symptoms na hu a wo adwen or say just the usual malaria. My friend is usual because now we become used to it.
Yeah.
All right. The usual malaria. No. That symptom may not be the usual malaria. It's my dengue fever. So, uhu bibisa na get tested first. And to say, even a pharmacy, they can do what we call the RDT, that's a rapid diagnostic test.
Okay.
Yeah, more use test case. Pharmacies, drugstores, and clinics. Bit my and who say, oh, we are malaria, so let's treat. And also, we have assessment. No, it goes beyond the usual malaria. Then they will call in the team to come and maybe take some sample and go and run the test. Then we see. One thing is, in Ruby to say aspirin.
Okay.
A Ruby to say diclofenac. A Ruby to say brufen. Usually, so BT and ya no a quarter diclo, a quarter brufen, no offer. When it comes to dengue fever, please, you don't take those kind of drugs. And now any drug that fall under what we call the non-steroidal anti-inflammatory drugs, NSAIDs. The friend NSAIDs, non-steroidal anti-inflammatory drugs.
Okay.
It be a aspirin, it be a brufen, it be a diclo. What happens is that this class of drugs, they also increases the tendency of bleeding. Already the dengue fever no predispose you to bleeding. That is why you can vomit blood or you may see blood in your stool. Do you understand? So if you end up going to take brufen, diclofenac, aspirin, or any other drug that falls within the NSAIDs, that is the non-steroidal anti-inflammatory drugs now, you are increasing your risk of bleeding. And now you are also near and say, oh, say create more complications. Then one when you are a better obituary.
I see.
And see, before you start any treatment, let's get the right prescription or get to the hospital. Then we know what to do for you.
Doc, where the my main concern we reality. Oko ye counter medics here, and I say omo pharmacy near there. Bibre any knowledge about this thing I can want say me. Ono ne de ne say oba ya one more sentence na no year duro no the amount. Until even they could even contribute to what you are saying. And he said no ya omedema victims see.
Yes.
Another school of thought. Second one ni mama fe no so entwem. Symptoms here akwakoye similar yi anipa akoya be you did talk of test which ebedi adanse say ebia malaria ne ade.
Yes.
Ye wo test kit a kire se wo de ya ebe kire se ade we ye dengue and I say ye malaria because so far I know of the malaria but I don't know of dengue.
Yes. All right, thank you very much. As we sit, you need sa rapid diagnostic test no your system no for now. Into the best thing is the public health department and I say when you go to clinic and a hospital na say omo per omo assessment no almost suspect say a bad dengue fever. They have a mechanism omo abe pick sample no to the lab.
Okay.
In some cases class omo ntimi enye sa test no facility ho a omo be transport you to a bigger facility omo bitimi run that test. See ebe kaya time COVID by all around the country they were transporting samples to Noguchi.
Yeah.
But when it comes to this condition too, for now they are running the test at that place. Internet the number of confirmed cases is slow to be updated because omuntimi test no most of the clinics and then the health centers. So they pick the sample and transport them to the best facilities that can run those tests. They will get it. Into say oko drugstore now o kano and our pharmacy or now my complaints are me pacho. That is the purpose of this kind of education we are doing. Not just nipa now no, but yeah so yeah more apomode and I say yeah tone ro more no. Don't just see say oh we wa ma complaint there then there's a fat cow. Then what did he? What I say nti oh my man way. One thing ya o intervention mum and be kunipa no. Because in America say bibi to say diclofenac brufen. Your time amount for especially when you have the diclo. But it be a old diclo new brufen now or day man and no be quite trigger bleeding. Nipa no bleeding. Anka woman e be a paracetamol the usual let me say this you can take paracetamol
Okay.
is safe you can take that one but brufen diclo and all the NSAIDs class groups drugs you can't use it into yen so aye ton ro ye run health centers ne ade we should also be aware and we should read around some of these things. We should seek for the best information so that we don't end up causing more harm to our client than doing good. You may be doing it with a good intention, but because one can also unim what you are doing, so you may end up doing the wrong thing. And when you do the wrong thing, ignorance is not an excuse. Even your own conscience will not leave you. So the best thing is let's use this opportunity to educate ourselves. Nobody knows it all. Even World Health sector anymore. And you'll be an asema making.
I said, and shut down tennis.
Yes.
Ghana Health Service and so and shut down create awareness and
yes. Ghana Health Service go so.
Ogusu,
you know, because outbreak, you know, usually outbreak basana. I feel na system also best steady condition ye understanding ye. No, also now go out to train people.
Okay.
But I said to train people at the various localities and as communities and our health centers, then they will not take it up. So I just into omugusu omoye the sensitization and training and gathering more data and then information on how we can push back this outbreak. And also I'm my lockdown.
Another
lockdown then assembly.
Na bibi say here ehun yan say ye de nipa ko no call isolation center na.
Oh.
Ana obetimi ni na tenefie enye hu sa.
We dey enye ayi ade a we say o ka say yamfa no call isolation center. We say we na enye say airborne. And I say by contact into wenya. Mostly when the thing is kind of very contagious and on the eye isolating if but we are it's not something that you can easily contact unless there is that human mosquito human interaction. So if we are able to kind of create a certain boundary at one side, say the mechanic no obi area you be make sure so be that net nti say if you know no on that net at least you more no kwan that net for now. What I say na say yen so you be use mosquito repellent na spray ni ade na net me aboy
na so obi wo fie ho no maybe a memfa ne sabo franya bi ni nua omanyina use the same sponge so
oh sponge ain't me maunya dengue fever sponge only need to the same sponge untimi
blisters nyina ni sauce ni ade nyina enye he.
Honestly at this point the person will not even be in the house. Time I'll be developed so the way be papa no by almost you be at the hospital. And so because of nipatimu and what they say BBC ne ba no when rashes I'm not even sure say okra na need use sponge you'll be comfortable using it.
We are humans so this is reality.
So what they for preventive sake what they at that point ne personal niema bi o use no nke be ya amomo no nko use especially brushes because say can say obesity bleed from the gum from vomiting and those things be o use brush na say virus no wo moja na e fi ne ase ana say when the num na so obi use ko use na e find it way into the person's system definitely the person will have it. Yeah.
And even me fa we so to also say owo fie ho no no eye de an tontomo de oni ababa betena nti se tontomo no so ka no a probability say ono so de beba won chen aba deposit egu mu no eno so ye high and say doctor ni nyina ko wie say yemfa nipa akono enko hye baby na on preventive we nyina because ono so be say oba ba mframa because of the itchy body no oba betena tontom beka no e kana obe deposit egu obim instead na yemfa nipa akono nkope baby ntina na yenhwe no
fine baby ne de o de be kwa akoto na distributor no delivery guys no so be your money mosquito delivery for no so be your money the fact is even before say sa blisters ne ade na wo hu no santun by then na ntontom aka na da nti ntontom obeche no okokra ya dispatch no manako so what I say nti the focus should not be isolating the person.
Okay.
The focus should rather be breaking the barrier. So our connection no never see breaking. But what I say, nti sanka ya dia airborne na never cast see the omukogu the other side of the community then you know omu need direct contact. But only need direct contact. Dispatch riders in so call eba.
Omo baby
So what I say, nti mosquitoes ne de omumum na wase yani ebre omo so na your system no so ana say mpanimfo so boa na ye hwese vaccine no ye benya bi aba oman and other but I believe say by now no they are working on some treatment okay because ebani say na eja omo so omo area yet to develop medications and things so they now take it upon themselves and then bring up something. So I believe something will come. But now emba ene die ntontom na ebetime kunu no ono mum na wase daily I think Andra Anopana I was going to cross check on the confirmed figures and it was done. No, sorry, I may check it. Unfortunately for me, now me feel hodom mosquito be am na to hodom on quite friendly. But as an time I may checking number of confirmed cases no minim so na adwen say me kwase o madwumo say den o na me hwe me san no osi ho
and
and then man fancha no
na peche do
no flat me kunu flat, and I made sure say obi the boss or smart no on dispatch anybody to my house like that again. So let's try to eliminate the mosquito contact and as a bite, and no more. And now one other use so I can say mostly in our environment, we stagnant waters.
Yeah.
We say gutter na nsuo ejinam obi edi ne park we didi awie no ato park na twene nsuo to ana a collect in the park kube they say kube aba system no di kube no wie ano ato
shell no
ato atwene na nsuo to na akwa jinam, and then other you say car ties or they say na edida, so any container na say venue be an object be a bit ma carry nsuo, because say carry nsuo na say aboa no ekofa virus no or the comma obi director. That is one. The other part is that obesa akotu nkusua agusa nsuo no any na abobo then multiply. So it means that nanke one mosquito na be a what a dem has say at least one mosquito then can before say obeko haba it will take a lot of time. What I say and I say obi ku ono a nanka we are all safe. But say you create environment e we I say na so okotutu nkosua na obobo na na ma 10 e be ka no ho a you can imagine
Oma
multiply nti omoko pick virus na ba menkwana ebi a mosquitoes 5 akamenne ebi emu 3 and kura dengue fever, so you can imagine. And I will start showing symptoms, and then my symptoms will be very severe because the viral load will be more. But what I say nti sa and I few mu bucket na nso, especially as most communities are pipe in term flow to be see assess nso egu bucket mu containers barrels na esisi oni ebibio so na esi u feel horn man as esi what them you understand, but the fact say on cover so no a bit mama or mark bridge on that so now wow bucket of water na esi wona no o mekwa akotu nkusu so within some days, roughly by 10 days na abobo na oma multiply. So you can imagine say every 10 days obobo for e fear within 1 month na so oma 10 na wo there every 10 days we are 10 every 10 days we are 10 wo fear on ma times 4 weeks ukra 40 plus ono ankasa ono ne kunu eka ho that is 42. So I said ne manu so be nyina be multiply na just say wo there onu fear de ahwe ne ya just amusi company or honum na
but dog asemi a ye ka ho asemi ye shase e fight and as e combat mosquito enye ne me kai say those days my childhood days ye kan omo a ye fa omo ye malaria advert e wo Ghana counting malaria out na me ka ho bi enti hwe bebi a meduru enye ne sa advert no a omo ye counting malaria out. I was part achepa ema ye ko role awareness me kai those days national theater ni eko de eko institutions bebre organized by GES Ghana.Education Service in partnership with Ghana Health Service ema ye release ade no pa be peme na menyi a meti TV so it's still tonton ene ye nete enti no ade na o se ati asese oma baba ye nuanom enya ade o mo beko. So no matter how we fight with them, they are still with us, because as same me can no counting malaria out. I was part it's still yane tonton nete still malaria yenya bi typhoid fever yenya se dengue ababa beka. So is it that if ye nipa na ankasa ne invite omoba ana say yen Ghana na ankasa ne ntimi combat this malaria in free hono ana say mosquito na ankasa yentimi combat ye?
Okay, me da say so say the waka no no kre sa pepepe. However a two-way affair. Yentimi and combat mosquitoes no the war against mosquitoes in our communities, no, we have not won. Though we've made some gains, but we've not won. And if yan so nipa no, because how do they multiply? It's for us to have that environment and as a breeding grounds or places within our community. It is our breeding grounds in Honoma. There's no way they will multiply.
Sure.
What I say, almost so better. But you create an environment in more. So say when you go around, you see a lot of open drains.
Sure.
Your gutters, most of them are open, and they are choked. Into so to flood and a banner pressure no Korea, they are cannoned at gutters.
Okay.
And these animals breed in those gutters. And I say, on and mantema, Ubafahana empty gallon be the ho, Ubafana car be the honum. To say, Crana scraps dealers near there now, bars, they say, I say, young a lot of waste materials are around. But still, when you go to some areas, you still find water stacked in some objects. To say, could be a year, any takeaways near other environments. And now, baby, what swampy areas, okay? Being ensured at baby, we don't fumigate the place. And you fight against, so sometimes too, we have to blame our big men also in some way.
Do catch my abang. Big men no more near abang.
Or more ready to take on the fight. No, young resources no ko. Near the aqua more be no on paper no a fighter, but on grounds on chat
fighter.
Near say young resources no sikane adiana or tono or the ayadi obey. Well, try report ten neko. Adia tiani asako je another grant,
money
another
donations in the breno.
So what I say. Meanwhile, your young guys in the communities are what they say, training within some 2-3 days, training on how they should go about educating people or eliminating this kind of things around the community now. They will do it perfectly. But scanning go, and I said the resources will not go there. Sebe, you were in Krasia, okwa malaria cases near more. But obite community be a well-developed area, malaria yinya more honum. And so you pay specialists and our resources are treating malaria. Oko nkras ho eni ho. Oko krokasi enu anase baby a eye memfa say the elite area efi papa bia ni honum omu ni open drains. Omo ntoto niema ngu basabasa be contain nsuo na amaboa na bridi wo no obekọ homom ni a packing resources akwa kogu ho no na agu warehouse bia na spy na ska bia kodi baabi ya de workshop ya de den ni ye workshop no head office ye workshop wa Accra ha miwa okom krase a ohomom na nkomu hia workshops but obetu ne car akọ ho no makoye no onko obetena ha ya no aye no raise memo say my way so there obi a che na de no odete social media no okasa what I say baby ayare no mom no onko ho no. So I think the approach should be say young call to the grounds your data trace malaria cases and also mosquito cases no more at certain areas of our communities. Even in Accra we have some areas on in the area where there mosquitoes dear senior men no no more that I say or say mosquito ghettos what I say until say cause no now confront the issue you get a better results than say betina excuse me betina baby unim say the rate is not much but you are there putting your energy, putting resources there.
Obeko Jamestown, Teshia kwa ya de no aba East Legon. So new amount for ba kasa. Na East Legon why na won hada je.
Any ask me. So priorities and then the way we handle our things. I think we have to really look at that. And like yeah so no temamufo no. Yes so I was say yes so how e be boy yan kasa yan ho ban. You are your own doctor. So I say before I say obi betutu ne nan akọ hospital no na che say ade a ye no ono na ebe ka kire o say we na ya me we na ya me
okay
na che so ono aye ne ho watimi ahu say ade we a ya me enye normal na enye saada na ete nti watimi diagnose no say me ho mfa me just so ntimi nto yare ni di wudi na o de to yare ne da so change the condition onim nti na obae nti na nipa bebre on mo call hospital a obi oba say me ka me yale ka doctor no wa asema me ka anya no ho aduro na odema because the person knows say na ko expect say na nka be what you say nti the people also know what to do. Just say sometimes either by ignorance and I say yasheda and now what said that you be the benefit of sa wrong now who create and I say mess now ye create no na ya say oh area mu hafo na ho yefi nti emfa me ho forgetting some mosquito no okoho kofa a ontena ho obeba wo side ho nom no nti eden ya you also benefit from ade na wo say emfa ho no but what you say nti it's a two-way affair. Young penny should look at the people they give the job to. But I say some people are grassroots workers. Omuji adwuma no ewo a former nkasa. Ebi mu so ayo managerial workers. Nti na adwuma bi wo ho no ma enya managerial adwuma. Grassroots. People are ready to do the work. But we be say obi be say semi permeable memory bi abe
na wakati ade
no no mu che passes no I say onyo pass.
All right doc ye beda wase pa ma o final message na ye fan sorry so ye brain nti
yo so my final message and say enne say ne yesua no dengue fever e wo ba bia e wo ye Ghana ha say. But just say you intimate confirm it because mosquitoes were hot there. Then the risk say a honor is there. Just that you confirm it.
Okay.
So don't assume say you who are central region, any eastern region, into Accra. For a ban say a eastern region. Send them a kind of for flight to be for baby aba. My join any aba. Sa no bit to join any VIP bus. I call Accra. I call Tamale. Sa no bit to join the trotro. Inti ya mo ya ho ban. Ya use mosquito repellents no. Ya share entirely a be cover ya ho. Ya ni anom ma na aja omo de omo say entirely ntita no be she no. Ene ene omo de omo ba be another form of breeding grounds ama condition no. Inti esre omo sa breed yan ka ya omo share atale e be cover omo nine ene omo nsa ka be boy na mosquito net no so ya use. Na say who all and one of the signs in anybody don't self-medicate.
Okay.
Go to the hospital or you contact any medical person you know. So you can contact any medical person, speak to the person, and we'll help you to help ourselves. Thank you very much.
Doctor, answer be konibia no be epe say ono wudin komo na say baby chira kwan.
Okay, so may available so let me give my contact so that if you need to talk to me we can talk. It's 02499 76159 02499 76159 Medini a Bencare and for now I work with St. John's Hospital.
Okay,
yes.
St. John's Hospital.
Okay, yes, that is around Tantra Hill.
Tantra Hill.
Yes.
Go filling station.
Yes. And me run this a health platform. I friend knowledge is power. Okay. It's a big platform. It's on WhatsApp. And we give health education. In fact, also we have other medical professionals, doctors. Some are within the country, some are outside the country. What we do is health related issue now the bar. Please, yeah, because it's a platform, you can't say can more platform no so, but you can pick my contact on the platform, talk to me, then I see who can help you, then we advise you,
Okay.
and then how we can guide you to get out of it. And free and
Wow.
thank you.
All right. It's ebusia ye better doctor say. And opinion ye ni share ye na say doctor ni share ye twetwe nkobo ni din ye de Benjamin Yamuha amanfo bebre na efre no Bencare sana omofre no. Se na me din kaka no wa che ewo edwuma mpa. Oye nema bebre. Se na de ni number 2 ja no. Bibie ha obia no. Obetima afre no na oni ne esusu hu owo mre edimani papa to ono ebetwetwe nkomo nti ye discussion hanom ne edi besi se ne be ya other programs no betima to aso na bibia aye kama ede amaye nyina medin ede abrantie kwesi jemfi ye ntwan ye woni emra ye ba de aka nyina ye de beto